All right, and moving on to inflammatory bowel disease, the last disease of the evening. So inflammatory bowel disease is ulcerative colitis and Crohn's disease. And the main difference between the two is that Crohn's disease can affect any part of the digestive tract, so we say from mouth to anus, whilst ulcerative colitis affects only the large bowel and the rectum.
And whilst I don't have a map to show you, Crohn's and ulcerative colitis are estimated to affect around 20,000 New Zealanders. So New Zealand has one of the highest rates of Crohn's disease and ulcerative colitis in the world. So irritable bowel disease is characterised by gut dysbiosis and a disordered immune response, triggered by a combination of genetic and dietary factors. In general, healthy diet patterns centred around whole food plants whilst minimising animal-derived and processed foods is associated with a lower risk of developing irritable bowel disease.
This is a report from the large European prospective investigation into cancer, so the EPIC study, and included 413,593 participants from 8 European countries. The study assessed the impact of protein source and the intake on inflammatory bowel disease, both Crohn's and ulcerative colitis. After a mean follow-up of 16 years, 177 patients with Crohn's disease and there were 418 with ulcerative colitis were identified.
The results did not show an association between total protein intake and the risk of Crohn's disease or ulcerative colitis. However, total and red meat consumption increased the risk of ulcerative colitis with every 10 grams per day, increasing the risk by 5%, and those consuming the most increasing their risk by 40%. Meat consumption did not appear to impact the risk of developing Crohn's disease. So the key components of the diet that have been implicated in the pathogenesis of irritable bowel disease are diets high in saturated fat and sugar and low in fibre. Food additives, including emulsifiers and maltodextrin used as thickeners and sweeteners, thickening agents used in dairy and by the sauce industry are also implicated. These adverse dietary factors alter the gut microbiome in an unfavourable way, leading to overgrowth of pathogenic bacteria, reduced bacterial diversity, inflammation, and increased intestinal permeability.
This study investigates the impact of the diet pattern in 125,000 participants of a population-based cohort from the Netherlands. Participants were followed up after 14 years. During this time, 224 individuals developed ulcerative colitis and 97 developed Crohn's disease. Results showed that a Western-style diet pattern characterised by high intakes of snacks, prepared meals, non-alcoholic beverages, condiments, sauces, and low in vegetables and fruit was associated with a 16% increased risk of developing Crohn's disease.
A carnivorous pattern, including high consumption of red meat, poultry, and processed meat, was associated with an 11% increased risk of ulcerative colitis.
And then this last study here.
So the use of plant-based diets in irritable bowel disease is currently being used by Japanese researchers who have been using this in clinical practice for over 15 years with incredible results. Their plant-based diet is really a semi-vegetarian diet that includes yogurt and allows for fish once a week. Their plant-based diet scoring system considers 8 foods to be preventative factors for irritable bowel disease. So vegetables, fruits, pulses, potatoes, rice, miso soup, green tea, and plain yogurt. And then 8 foods to be harmful: meat, minced or processed meat, cheese, butter, margarine, sweets, soft drinks, alcohol, bread, and fish. So they've had really good results and durable remissions in both ulcerative colitis and Crohn's, and have also demonstrated high remission rates in combination with medications. They have not seen a negative impact with the high fibre content despite the prevailing advice to limit fibre consumption in the acute phase of the disease. And if we look at the graphs here, Graph A shows the induction rate of remission by biologics in Crohn's disease. So when it's combined with a plant-based diet, 96% of the time there was remission of Crohn's disease, which is really huge. And then graph B demonstrates a plant-based diet that saw 100% remission rate at 1 year for Crohn's disease, which is just incredible. You don't see this in the hospital. And then graph C shows remission rates at 1 year for ulcerative colitis. So again, you've got the plant-based diet in A with people in hospital, and then you've got people doing their plant-based diet outside of hospital in column B. So in summary, we've looked at colorectal cancer, breast cancer, prostate cancer, and inflammatory bowel disease. And these are diseases of the Western world and of the Western diet. And then I've just put up these dietary guidelines because I really like Canada's dietary guidelines, because they kicked industry out of the way and looked at the science instead.
Ooh.